Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted by Kim Rich in American Sign Language, and Carlos Saracida is interpreting the press conference in Spanish. His interpretation will be available shortly after the press conference concludes on the county's website and YouTube page. I have some good news and other news to share today. The very good news is some businesses will be open today for the first time since Governor Newsom's stay-at-home order began in March. The businesses that will reopen today for customers to pick up items are clothing stores, bookstores, toy stores, music stores, and most importantly, because it's just in time for Mother's Day, florists. This is a once-in-a-lifetime opportunity to really help our local florists and the Santa Barbara County cut flower growers who have been especially hit hard by the economic shutdown. The cut flower industry in our county has experienced a more than 80% drop in sales recently. I have had many heart-wrenching conversations with local business owners who are clinging to hope their businesses can survive this historically tough economic time. They are all counting every day until they can reopen, and many are worried when given that opportunity, customers will still be too afraid to shop. I don't think that's going to happen. I believe each of us deeply understand what's at stake in this moment, and we can't wait to help support local businesses and their employees. These are our neighbors, and they have supported our community for decades with their volunteer time and their donations to youth sport leagues and nonprofit fundraisers every time they have been asked. It's our time now to show our love and support for them when they need it most. This weekend, please make it your highest priority to call one of the businesses that have reopened and order something, anything, over the phone. You can pick it up anytime, but call to place an order this weekend. Don't forget to also order takeout food from a local restaurant this weekend to show your support for our restaurants and their employees, because they also need every dollar of support now. Unfortunately, I also have some not so good news to share. Yesterday, Governor Newsom announced the new state requirements counties must meet to begin opening even more local businesses. The new state regulations are much more restrictive than the governor implied earlier in the week. The first and most strict condition is that there must not be a single COVID-19 death in a county for 14 straight days. Unfortunately, Santa Barbara County cannot meet this threshold. The sad truth is that there has not been a single 14-day span in our county with no COVID-19 deaths since the pandemic began. The COVID-19 outbreak at the Lompoc Federal Prison complicates our local circumstances even more, as we are responsible for the tracking, monitor, and reporting of COVID-19 cases and deaths at the prison, but have no authority to resolve the problem. The federal penitentiary is controlled by the Federal Bureau of Prisons, and while our public health department continues to try to assist the prison to manage the outbreak, we have been consistently rebuffed by prison authorities. Yesterday, immediately after Governor Newsom announced this new restrictive reopening criteria, I asked our local state legislators to lobby the governor to address this inequity with the federal prison through new state guidance that would address our unique situation. Senator Jackson and Assembly members Lamone and Cunningham have each pledged their strong support and have already communicated the urgency of this issue to the governor's office. The effect of the governor's new requirements is only a handful of the most rural, sparsely populated counties in the state will meet this new reopening criteria. These new requirements are not what we had been hoping would be announced, and not what we had been preparing to meet when the governor announced his 6 preconditions for opening more businesses. Santa Barbara County residents, along with 95% of all California residents, will continue to be bound by the governor's executive authority and statewide stay-at-home order. Executive other orders the governor has issued have the force and effect of law. Local governments may not limit or lessen the restrictions described in the governor's stay-at-home order. Some elected officials around the state have argued counties should simply defy the governor's order and do what they want. The governor's authority to act in a public health emergency is very well established law that has been tested at the United States Supreme Court. Governor Newsom today reminded local governments that have already exceeded the limits of his statewide stay-at-home order. They are putting at risk billions of dollars in financial reimbursement from state disaster assistance funds. Governor Newsom also reminded us the public health stakes remain very high. The virus is not gone. If we don't want to risk a second wave of outbreaks, we need to continue to be vigilant and attentive to physical distancing. We are making progress against the virus, not as fast as we'd all like, but progress is being made and will continue if we persevere through this very difficult phase. Finally, I'd like to recognize the important work of the Immigrant Health Rapid Response Task Force. The task force is working collaboratively in partnership with the Santa Barbara County Department of Public Health to improve access to critical public health information to our non-English speaking neighbors during the COVID-19 pandemic. Our ability to effectively stop the coronavirus depends on the awareness and participation of every resident of Santa Barbara County, regardless of their immigration status. The virus doesn't discriminate, and everyone in the county must have the best information available about what to do to keep us all safe. The community organizations like CAUSE, MyCOP, the NAACP, the Pan-Asian Network, El Centro, and many more organizations that are participating in the Immigrant Health Rapid Response Task Force are trusted, culturally competent messengers in communities that have less access to traditional public information sources. The County of Santa Barbara depends on their collaborative efforts to spread critical public health information to all of our county residents. I deeply appreciate their dedication and commitment during this public health emergency. I'd now like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are saddened to report 2 additional deaths in persons that tested positive for COVID-19. One person was a resident of the city of Lompoc in their 60s with underlying health conditions. The other person was in their 70s with underlying health conditions and was incarcerated at the federal prison complex. We extend our deepest condolences to the families and loved ones of these community members. Today we are reporting 311 new cases of COVID-19. 310 of these new cases are in persons incarcerated at the federal prison complex in Lompoc. Only 1 new case is in our other Southern Barbara communities. Of the now 1,032 cases, 464 people have fully recovered. 39 are in the hospital, with 12 of them in the intensive care unit. 225 are recovering at home. Fortunately, our hospitalization rate and intensive care unit admission are remaining stable, and the hospitals are operating below their capacity even after the introduction of elective surgeries and procedures. This is very reassuring. Our physical distancing is obviously working. Be advised that the Lompoc Federal Prison is currently testing all of their inmates as a general screening program. Subsequently, our county total testing numbers and positive cases are much higher than if we only counted the general county population. I'd like to acknowledge the many questions we've received regarding the discrepancies between our reported case count for the federal prison and the cases reported on the Bureau of Prisons website. We report the numbers that our disease control team are able to process by noon of any given day. As we are receiving large amounts of data from the prison, it is inevitably taking much longer to process all this information. Additionally, we are reporting total cases over the course of the outbreak as well. About 70% of all prison inmates that have been tested so far have come up positive for COVID-19, regardless of their symptoms. As a matter of fact, the vast majority of the positively testing individuals report no or very mild symptoms only. Other high-density congregate settings, like nursing homes in other counties, have also shown to have very high positive testing rates when the whole institution is being tested. This confirms the fact that the virus is highly contagious and that prolonged close physical contact makes it very likely for the virus to spread. Currently, we are testing widely in the community through our 3 new testing sites, one in Santa Maria, one in Santa Barbara, and one in Lompoc. All sites will be open through the weekend and actively testing. I continue to encourage all community members to get screened for testing and make an appointment online at lhi.care/COVID testing. Again, lhi.care/COVID testing, or call 1-888-634-1123. We will have the results in the near future from these testing sites, and they will give us a better idea about how much our general population has been in contact with this virus. Today, as announced by the governor, we are entering stage 2 of the statewide roadmap to recovery. The goal is to open the state as safely as possible in order to avoid another flare-up of the pandemic. Our total case burden, hospitalizations, intensive care unit admission counts, and ventilator use will be monitored every day by local public health department, that is us, as well as the state health department in Sacramento. We want to make sure that more mobility in the public that is now occurring due to the easing of the stay-at-home order, that this will not lead to dangerous rising cases. Once we feel reassured about our safety, we will gradually extend the opening to a wider range of businesses. Later today, the Santa Barbara County Public Health Department is also coming out with an updated health officer order with clarifications to align directly with the governor's executive order. This will allow the reopening of phase 2 lower-risk businesses. Additionally, guidance will be provided regarding pool use with physical distancing requirements. Thank you.
Thank you, Dr. Anzorg. Next, we'll hear from Dr. Stuart Comer, the county's lab director at the Department of Public Health.
Thank you, Supervisor Hart. I just want to reiterate what Dr. Anzorg said. I think it's very encouraging that we're entering the next phase. All I'm going to report today is that the 5th and final hospital in the county now has rapid on-site testing for COVID. And the importance of this is because we really, all 5 hospitals, as well as the surgery centers, are extremely mindful of testing their patients before procedures are done to protect both the staff, the patient, and the broader community. And I think now that we have that capacity, it's very, very encouraging. So that's all I really have to say, and thank you for all your continued vigilance in this continued fight.
Thank you, Dr. Comer. Next, we have Suzanne Grimacy, who's here to speak about the county's community wellness team and how each of us has unique challenges managing our mental health during this very stressful time.
Thank you. Here we are again, entering another weekend, the 9th to be exact, since the stay-at-home orders went into place, all in this together. But in different situations, whether you are someone working from home, trying to juggle being a mom, being a dad, being a caregiver, helping with homeschooling and work, and all the new stresses that come with that, or whether you're a parent that painfully is away from the home at a time you know your children need you for the at-home schooling, and yet you're an essential worker, so you're called away. Whether you're alone and protecting your health at home, but you're feeling isolated. Whether you're in an abusive relationship at home and you just want the orders to lift. Whether you're living with your children fearfully in a living environment with many other people who you don't see practicing safe guidelines, and you're fearful and you feel vulnerable. Perhaps at this time of the year, you're grieving the loss of a loved one, and that is complicated with all the challenges of COVID-19. Or maybe you're a student desperately wanting to be back with the routine on your school campus and with your friends. Or maybe you're at home with your family and you're thoroughly enjoying the extra time. We all may be in different situations, but for all of us, this has lasted a really long time. People are feeling rightfully so exhausted, tired of making decisions, trying to remember to wear masks, and I think feeling a sense of burnout. And not a sense of burnout that can be compared with any other, because this is completely unique. And our regular coping mechanisms are not things that we can use right now. We can't go out and play a sports game to blow off steam. We can't gather with extended family. We can't go out to dinner with friends. We can't even aimlessly wander in and out of the shops of a shopping mall. But despite feeling burnt out, we have a really important job to do, all of us together. If you're at home and you're feeling helpless and feeling like you don't have much of a way to contribute to changing the situation, please know that by doing nothing, you are absolutely doing something. We all have a job, and we're all in this together. Also, really important for people to know, an invisible group of people, there are teams of people working behind the scenes daily, if not 7 days a week, many of them working 12 hours a day or more, every single day, working as hard as they can to try and get our community reopened for all of the different people I named when I started. And I know this because I see and I work with these people every single day. There are people trying really hard, and we will get back to a new normal. But you're all a part of this too. As hard as it may be to remember, this is not a situation that will last forever. We need to keep doing our parts. But we're seeing exciting things too. Today is exciting. We're seeing a small movement with the opening of curbside pickup at some of our local businesses, and that is really exciting to see. And some of the creativity and the innovation we've seen of store owners getting ready for that is just wonderful, and we appreciate it. We simply must keep on keeping on. Some tips to remember to take care of ourselves during this time: limit media, find a few good sources and just check on them once or twice a day. Keep your routines or make new routines, but keep routines being a part of your normal activity. Take good care of yourself. Drink water, eat healthy foods, sleep, get outside, move your body, and most important, stay connected. In closing, May is Mental Health Awareness Month. It's a time to knock out the stigma of mental illness, to create hope and to strengthen our community. The Department of Behavioral Wellness, where I work, is doing a lot this month. And I want to share with you, because we encourage the community to be a part of that. The theme for this year is to express yourself. And if you haven't already, you'll start to see beautiful chalk art popping up in sidewalks, in front of homes where older people live, at some of the pickup sites for food, anywhere where positive messages can be lent in color. Another thing are positive words that you may see popping up around town on fences. We encourage the community to do the same. Pick up a piece of chalk or a few colors and cover your sidewalk, both directions, but to share that positivity. When we are able to care for ourselves, we are stronger, we're more resilient, and we're able to care for others, and that is exactly what we need right now in our community. The Community Wellness Team remains available as a number to call and get connected to counseling resources or just a person to talk to. That number is 805-364-2750, or you can go to the website at sbccwt.org. Thank you.
Thank you, Suzanne, for that really positive and affirming message today. We'll now go to questions in the room. Mr. Fish?
Hi, you shared some numbers and just wanted to see if you could clarify the recovered hospitalization and ICU numbers that you gave. Were those countywide or were those community separated from the prison? Could you just kind of clarify the community numbers compared to the prison numbers?
The hospitalization numbers include prison inmates and community members. So do the intensive care unit numbers that I'm giving.
Do you have specifically the number of people from the prison who are hospitalized or in the ICU compared to the community numbers?
The Bureau of Prisons does not want me to convey this information.
I had a follow-up, I guess, sort of similar to that. Supervisor Hart, you mentioned reaching out to the Bureau of Prisons, offering help from the county and from the Public Health Department. What kind of help did you offer? And what was, you said you were rebuffed. What was the response from the Bureau of Prisons, and why were they hesitant to accept that or share more information with the public?
I don't know the answer to why, and I do want to say something maybe to start. It's important to recognize that I have been contacted by many members of families of people who are in the prison, and they're very concerned about their loved one's medical situation, and they have not been able to communicate and learn the status of that, and that is very disturbing to them and to me. Every single man who's in that prison is a father, a son, a brother, or a grandfather, and they have loving families at home that are very concerned about them. And we want to know what's going on in the prison, and we have not been able to get adequate answers. I think it is striking that the difference between the work that Sheriff Brown and Chief Wasilewski have done in the Santa Barbara main jail to keep our situation under control and in a safe environment for the prisoners in our jail. And I would hope that the prison in Lompoc could achieve the same results as soon as possible.
One more follow-up just about the inmate death that you announced today. Does that happen to be the same inmate that was announced Wednesday from the Bureau of Prisons as a second COVID-19 fatality?
Dr. Ansberg, do you know?
That's possible. All I know is that this person did die on Wednesday, May the 6th.
Thank you. Any other questions? Okay.
First
Next,
up?
we'll go to questions on the phone.
Yes, we have several. First up, Josh Molina with Newshawk.
Yes, I have some questions about the situation at the Lompoc prison. Is it the county's contention that in terms of the stages that the governor has set for reopening, is there a county effort or Chair Greg Hart, is it your wish that the Lompoc prison numbers be separated from the county's numbers as not to hold the rest of the county back from reopening? That's question one.
The answer to that question is yes, absolutely. That's exactly what we're communicating to our state legislators and to the governor's office.
So do not staff come in and out of the prison? So theoretically, if you work at the prison, are you not coming home at the end of the day and recirculating back within the Lompoc and the county population?
Yes, and we understand the distinction between inmates in the prison and the staff, and we are prepared to be responsible for the staff, but cannot be responsible for the inmates.
I mean, I guess my question is, if we know that we can carry the disease with the virus without knowing it, why would we want to separate the county numbers at the prison from the rest of the county if there are people going in and out and back outside of the walls?
Well, the point is that we can manage the people who are coming in the community, but we have no authority to manage what's going on inside the prison. And the standard that the governor has established that we cannot have more than one or no COVID-19 deaths over a 14-day period makes that, achieving that, out of our control.
Okay, and one more question for Dr. Ansberg. In light of the fact that we have to go 14 days a COVID-19 death before reopening, if we're not able to separate the prison numbers from the county numbers, do you have a medical perspective If we have 650 positive cases at the prison and we've got to go 2 weeks without a COVID-19 death, and we're having more testing there daily, do you have an estimate on how long it will take before we can go 14 days in this county without a COVID-19 death?
I do not have an estimate of how long it would take not for anybody with COVID-19 to die in our area. What I do know is, though, just to take a little tension out of these numbers, is that this is just a start. From, I'm in very close communication with the state health authorities, not so much with the governor, but with the State Department. We are on first name basis, and we talk 2-3 times a week at length, and we discuss these issues, all health officers with the State Health Department. And my understanding is that this is just a beginning metric. This is just a measurement to start slowly and safely. And we will monitor this daily on a local level, on a state level. And once we see that what we are doing is safe, they are very much interested in opening up faster. We are very much in alignment with the state. So I would encourage everybody to sort of take a deep breath. Let's take what we have at the moment and be assured that the state and Santa Barbara County will go further with opening up as soon as possible, given that this remains safe. But because it's such an unusual situation, we really have to tip our toes into the water and check it for safety and temperature before we wade in a little further. In these times, 1 week seems like a decade. So what we talked about a couple of weeks ago seems almost irrelevant at this point. So please be patient, and I'm not anticipating that this will take a very long time until we can open more.
Okay, I appreciate that. Finally, do we know in terms of, I just want to follow up on that point. If there's 650 people in the prison, do you have a medical perspective based off of any of your data? How many of those are going to recover and how many are not? That's a lot of cases, and we know those numbers are going to continue to grow at the prison. I'm just wondering if you can give sort of a percentage, statistically, how many you might expect might die when they have COVID-19 in that facility.
Yeah, thank you for the question. Maybe it was a misunderstanding earlier, but when we count cases, that means positive test results. It does not mean sick people. So what we are actually doing with this huge amount of testing, be advised there's like 3,500 inmates, and we're talking 450 staff. So it's a small town on a very small parcel of land. So what we are learning is that apparently 70% so far have been testing positive, even though they are not really sick. Now, don't get me wrong, there are some who are ill, and there are some who are in the hospital, even though I can't tell you how many. And I can also share that they did put up a little hospital with 20 beds for their own care on site. That is news. That news has been released by the Bureau of Prisons, so I feel comfortable saying that. But I'm unable to predict how many people will get severely ill and how many people will die from this at the prison. Unfortunately, there's just no way of knowing. It's reassuring that the majority of these people who test positive are asymptomatic, and I wish them the best.
Josh has one quick follow-up, and then, Josh, we need to move on to the others. Thank you. Go ahead, Josh. All right, we're going to continue. The next up is Delaney Smith with Santa Barbara Independent.
Hi, thank you for addressing the discrepancies in the Lompoc prison numbers. And most of my questions honestly have been answered and asked so far today by other reporters, but one quick follow-up that I was wondering about is with the new 20-bed prison on site, are inmates who were previously in area hospitals transported back into that prison, or are they staying in the hospitals that they were in until they're fully recovered?
I do not have the answer to that question. I know that the Bureau of Prison is very concerned about the safety, and that's why they stay very close with that information.
Okay, thanks.
Thank you, Delaney. Next up, we have Reza with San Ynez Valley Star.
Hi, thank you so much. So do you know if they're separating the prisoners that have underlying conditions at the prison? And also with the underlying conditions, is there any way that you could tell us what some of those are looking like, what the percentages of people who have died, if they have hypertension or if they have asthma or if they have, cancer or something? I think it would be good to let the public know that, you're seeing more severe cases with this type of underlying condition. So if people have that, they can quarantine themselves or, be extra cautious when they're out in public.
Do you mean in the general public or in the prison?
Both.
Itself? Well, about the prison, I honestly do not have any information.
Okay.
And about the general public, it is concerning to us that most of our cases are actually in the age bracket between 30 and 70. Now, the over 70s, elderly folks, unfortunately, sometimes get more severely ill, but that is typical for any kind of pneumonia. Older people very frequently die of pneumonia, and that could be influenza or it could be a bacterial pneumonia, and COVID-19 is not different. It's just another virus that causes this severe infection, and
Right.
elderly folks just succumb to that more so than younger people. But what we have seen also is a lot of people in their early 60s actually died. And just a few days ago, a relatively young woman in her early 40s died. So that is concerning, very concerning, and that's why we take this so seriously. And the underlying conditions, they span anywhere between cardiac disease, coronary artery disease, diabetes is a big player. It seems even that obesity, and not just overweight, but really medical obesity is a high risk factor as well. So does that answer your question?
Yeah, and I would like to know too, if you have any stats on if any of these people were smokers as to non-smokers. Like, did smoking have more of a prevalence of severe cases?
It does not appear to be the case. Interestingly enough, smoking has gone down significantly in the United States in general.
Right.
What we initially, as clinicians, we were surprised how few people with asthma actually had severe illness. So underlying severe lung disease, yes, but milder lung disease doesn't seem to be a risk factor for dying.
Okay. And sorry for one more question, but I'm wondering if you guys have had any conversations with the school districts and, starting to plan for the fall and what that might look like.
Yes, the school districts and Susan Salcido, the superintendent of schools, is part of the recovery and reopening task force that the county has convened. And so we are having discussions with the schools. They are also working internally very diligently to prepare to be able to reopen schools as soon as they can and as soon as the governor provides the path.
Thank you, Reza. Next up, we have Tom Bolton with News Hawk.
Oh, thank you very much. I do have a couple of questions. One is a follow-up on the prison situation. I wonder if you can tell us, beyond the inmates, what has been the recent experience in terms of prison staff testing positive for COVID?
Dr. Answer, do you have any information about that?
Prison staff, we haven't seen a huge increase in the numbers. I'm not exactly knowledgeable about the exact numbers, but I do know that we haven't seen a huge increase over the last few weeks.
But you still are seeing some cases among the prison staff?
Yes, we are.
Okay. And I guess that my next question is probably for Greg. Clearly, the Bureau of Prisons is not very interested in providing a lot of the information that's being asked for. And can you tell us maybe more specifically what the county's doing to elicit better and more information from them?
We're working with our federal legislators, Congressman Carbajal and Senators Feinstein and Harris, to work through the process at the federal level to get better information and better response from the Bureau of Prisons.
And then another question just about the numbers, I guess, for Dr. Ansorg. Do the hospitalization numbers include people that are in the pop-up hospital at the prison?
No, they don't. The numbers that I give for hospitalized patients does not include the numbers in the pop-up hospital at the prison. We do not have any information about the site there, other than that they are having 20 beds.
But the number that you are reporting for hospitalization does include some unknown number of inmates.
I'm not allowed to disclose that.
Just the existence at all?
Just the existence at all.
Huh. Okay, thank you very much.
Thank you, Tom. And last up, we have Lisa Osborne with KCSB Radio.
Hi there. This is a little off of the track of the questioning tonight, and I haven't been on a news conference for about a week or so, but I don't know if this has come up. But so there's this effort to get a vaccine, but there's also, it's not clear as to whether if the person has the coronavirus or COVID-19 antibodies in their system, if they're immune from getting reinfected. Isn't the point of a vaccine to put a little bit of the virus into your system in order so you get immunity? Do we need to determine first whether or not a person can get reinfected if they have the antibodies before a vaccine would be feasible?
Dr. Comer?
That's actually a great question. There's a lot to that. The general question might be better answered by looking at how many patients who've had COVID-19 actually develop the antibodies. And recent indications are that the vast majority of them do. There are reports out that single-digit numbers do not produce the antibody. Then the next question that you're asking is, if you do have the neutralizing antibodies, does it necessarily confer immunity? And to be honest with you, Lisa, no one is willing to make that assertion yet. And California Department of Public Health has been very adamant at this point that we just do not know that answer. And the final element to your first portion of your question is yes, and this is one of the difficulties obviously in developing any vaccine, because some vaccines can actually, when you have a vaccine, you can actually become potentially more vulnerable upon reinfection with the same infectious agent by cytokine storms. Very, very small numbers, and this is, again, something that a lot of people don't know. So I think this is why there's such a tremendous national as well as international effort in trying to find out how best to go about with the vaccine approach with this. So more to follow. Good questions, though.
All right, thank you.
Those are all the questions we have.
Thank you. Please remember that Mother's Day is this Sunday. More than ever, it's critical to our sense of community to continue to celebrate life's important milestones while also being safe. With our local florist reopening today, it's the perfect time to pick up a beautiful bouquet of flowers and deliver them personally to your mother. Of course, our mothers would be the first ones to remind us to be safe and diligently practice the 3 things we must all continue to do to protect each other. Number 1, please stay home as much as possible. When you go out, wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands for 20 seconds. It's easy to forget the 20-second rule, but please pay attention to that. Don't touch your face and disinfect surfaces regularly. If you feel sick, isolate yourself at home. If your symptoms worsen, call your doctor or a clinic and follow their medical advice. Our next press conference will be Monday at 4:30. If you have any questions about any of the things we've been talking about, please call the county's call center line at 833-688-5551. Thank you for joining us today.